So I'm going to be doing my fake discharge teaching for the scenario of the X30 weeker who is going home on oxygen with BPD. So just the background, baby has bronchopulmonary dysplasia. He was on a mechanical ventilator for a few weeks when he was born, and now he's going home on supplemental oxygen. So our home health people have already done their oxygen teaching, but I just want to reiterate that you always are checking your oxygen tanks, and your at-home RT can help you when you need new tanks. You know who to reach out to if you need a new tank, and making sure that you're checking baby's skin under the nasal cannulas and that you're not getting any redness under there. And making sure that they're always on the right setting. Since you're going home on 1 liter of low flow, you're going to be making sure that your oxygen tank is always reading at 1 liter. If you have an at-home pulse oximeter, you're going to make sure that your baby's oxygen is at a good number. And your baby needs to go home on oxygen because they need the supplemental oxygen to keep their saturations up. So smoking teaching, I do know that you are smoking, and we have resources to try to help you quit smoking. As you have said, you're interested in quitting smoking. But something that's very important is to not smoke near baby at all, especially while they're on the oxygen, because oxygen can make a fire, and that would be very dangerous. Also, making sure that you're storing your oxygen tanks upright in a secure location, and your at-home RT can definitely help you out with that. Also, keeping the oxygen away from anything like in the kitchen, like your stoves or candles, space heaters, literally like anything that's flammable. And if baby's getting a little bit like irritated on the nose, don't put Vaseline in there, as that can like actually block the part of the nasal cannula that the oxygen is coming out of. And if you need to smoke, wash your hands, change your clothes after smoking, and don't smoke in the car if baby's going to be in the car. And for preventing sudden infant death syndrome, because your baby was premature and because your baby's on oxygen, they are at a little bit higher risk. So to prevent SIDS, what we're going to do is we're going to talk about safe sleep. So baby's going to need to be in their own crib. Baby's not going to be in the bed with you, napping or anything. If you're starting to feel sleepy at all, put baby down. And, baby safety is very important. Make sure baby is flat on the back. We're going to have a hard mattress in your crib, and nothing in the crib with baby. No pillows, no blankets, no crib bumpers, no toys, nothing. Keep it out of the crib. And make sure that baby's on their back. And then if you're seeing any signs of oxygen issues, like baby could look a little pale, a little bit dusky, like lips can turn blue, that would be a sign to call 911 and pay attention to your baby's breathing. Some babies have very irregular breathing patterns, as I'm sure you've noticed. He has a very irregular breathing pattern. That's very normal. But if you're ever unsure, it's always okay to call for help if you need to. And we do have some follow-up appointments. I know that 2 days from now you're going to have a follow-up appointment with your primary care provider, so it's very important that you go to that. Here's a handout for the medications that baby's going home on. Lasix and some vitamin D supplements and some iron supplements for baby. Make sure you keep the schedule. We've been giving him Lasix Q12 hours at 8 a.m. and 8 p.m. You can keep that same schedule if you would like. And as I showed you earlier, how to mix the oral medications into baby's bottles, since he takes his bottles so well. Just make sure that you're giving them every day and keeping track of them, and giving his supplements at 8 a.m. as well if you want to keep the same schedule. We're also going to perform a car seat test to make sure that the car seat is safe for baby to go home in, that baby has already passed his car seat test actually. So that was an important step for him. And I know I'm forgetting something. When should you call your doctor? So once you're discharged from the NICU, we are no longer taking care of your baby. So if you have any questions or you have anything that you need help with, you're going to need to contact your baby's primary care doctor, as you know who they are. If there's any emergencies, you're going to call 911 for that. Types of things you need to look out for is if your baby just stops breathing, if they're turning blue, especially their lips, if they are unconscious, if you can't get baby to wake up, this is definitely an emergency. You're going to call 911. We already did our discharge our CPR teaching, so hopefully you will never ever have to use that, but now you do know how to do that if the need ever arises. If you notice that your baby is working a lot harder to breathe as well, I think that would be something you should call the doctor about, because your baby does have BPD. It's going to be harder for them to breathe on their own sometimes. That's why he's on the oxygen. So if you feel like he's breathing a lot harder, those retractions that we talked about over his ribs, you might want to call the doctor for that. If your baby has a fever, as I showed you how to do the axillary temperature, if the fever is 100.4 or higher, you're going to want to take your baby to the doctor. If your baby doesn't have any wet diapers for 6 hours, or if your baby is really having a hard time waking up to feed, if you're waking him up and he takes less than 50% of 2 bottles, which is just our rule in general, that would be a good time to also call your primary care physician. And if you have any questions on any of this, you can ask me those now. And I think that's everything. We showed you all the resources, and you have your follow-up appointments, and you know how to use the oxygen. We've given you your smoking cessation education, when to call the doctor, and yeah, good luck.